Gotti, and on behalf of the Park Rapids Area League of Women Voters, we would like to welcome you and certainly welcome our panel. You know, tonight's presentation is the second in a series of two, where we talk about child care issues. Last night I was listening to a presentation by the St. Paul League of Women Voters, and the title of it was Child Care Equals Society Care. And we all know that, who have worked in child care for many years. Last month we were just really fortunate to have a group of child care providers. Carrie Smith was there. We had 2 licensors there. We had a parent and other providers who talked about the challenges and the issues that they face in trying to provide quality child care, maintaining child care, finding child care. And it seemed just logical that this evening we talk about kind of that next step, resources that are available, because there are a lot of great resources. And we're really pleased that we have a panel of experts here tonight to talk about what resources are available in our communities and how people access those. So we'll begin with Michelle Rakowski. Michelle is a 25-year veteran of the Head Start, Early Head Start program, and she's currently director of the program. She is also a licensed pre-kindergarten teacher. She began her career in early childhood as an Early Head Start home visitor and a center teacher and a coordinator, and now she's the director of the program. I just have to say I hired Michelle. It was one of the best decisions I ever made. Next we have Missy Okeson. Missy is a program officer and child care lead for the Northwest Minnesota Foundation, headquartered in Bemidji. But she collaborates with early childhood educators, community task forces, regional child care experts in the whole 12-county area of northwestern Minnesota and 2 tribal nations. So Missy really gets around that corner of the state. Next we have Krista Livermont. Krista is a child care aware and parent aware quality coach. She works with parents and providers in the quality rating system. And she also works from Ottawa. She brought 2 of her colleagues this evening, Sarah Holler and Kathy Stenberg, who also support the work that is done in this area. Maria Steen. Maria is the Child Care Connections Director for Lakes and Prairies Community Action. And really they do what it says. They connect child care and business and providers and provide financial support. She works in a very large area too, 21 counties and 2 tribal nations, and she just told me this evening that they've expanded into North Dakota. So, welcome. And Michelle Hutchinson. Michelle has really had a very long and diverse career, over 30 years in the early childhood field. She's been a parent on the Early Childhood Family Education Advisory Board. She has been a parent on the Head Start Policy Council. And Michelle went into business as a child care provider for her 5 children and other children when she couldn't find child care for her children. She was hired as the business development specialist with First Children's Finance in August 2021, and you're up in the northwest corner of the state too. So, ladies, welcome, thank you. We're going to start with each person giving a little presentation, and then we'll open it up for questions. So, Michelle.
Let's see if this works.
All right, so good night, or good evening, everybody. Like Leah said, my name is Michelle Wilkowski. I work for Ottawa Head Start. Our agency serves low-income families in Mahnomen, Hubbard, Becker, Ottertail, and Wadena counties. I am the Head Start director, so our program focuses on serving families with young children ages birth to 5. and pregnant women. And so in those services, we offer a home visiting option. We offer center-based programming that we own and operate the centers and hire the staff. And we also have a large number of family child care partnerships. So tonight we're kind of focused on the child care aspect, and we do child care both with family child cares and in our center-based settings. Currently we have an enrollment of close to 500 kids over the 5-county service area. In the Hubbard County area, we serve currently 54 preschoolers at Century School in 3 different classrooms. We serve 16 infants and toddlers in our center-based classrooms, and then we currently have 1 family child care provider contracted for 6 children over at the Sanford Counseling Center, kind of over by Walmart. We're looking to do some expansion and some changes next year, and for Hubbard County, that means we're hoping to add another toddler classroom. So we'll be going from 16 infants and toddlers to 24, so we're super excited about that. And also adding another family child care provider in the area. So that is kind of on the horizon for us. We hope to have those up and running all by fall. Our preschool rooms aren't quite traditional childcare, but they do provide childcare for a number of our families. So our preschool rooms run pretty much like the school. They follow the school calendar, school hours, September to May. They're off in the summer. But our infant toddler classrooms and all of our family childcare providers operate year-round. The family childcare providers, we're able to help and support childcare providers by contracting with them. They get to hold their license, be an independent business owner, but they contract with us with an agreement to provide Head Start services and to provide care for Head Start eligible children. So we're able to help recruit and find children maybe from low-income families that are maybe looking for work, trying to get back to school. And if they're eligible, we can find them placement in whichever option might fit them the best. The provider is paid their weekly child care rates, like any provider would be, but then they also receive an additional enhanced service fee. We call it an enhanced service fee for the additional Head Start parts of their contract. There's some work above and beyond licensing that they do for us that follow Head Start regulations. We are able to offer a lot of training and technical assistance. The CDA, which is the Child Development Associate's credential, we can train them in that and help them obtain that. Along with just basic child development training, curriculum and assessment training. All of our staff are available to work with the providers that we contract with in the same way they would work with our staff that work in the classrooms. Most recently, like I said, the new things on the horizon would be our, if you're familiar with the area, and over by our Mahabiawa building is now Kids Plus. It used to be Beds Plus. We picked the name not just because it was similar to Beds Plus, but also we really focus on serving kids in the whole family. So it's not just the children coming to school or coming to childcare. It's really about serving the whole family and helping them with upward mobility and being successful. So in that building, we've been busy renovating it for several months now. It's never an easy project, but when it's complete, we will have all 3 of our infant toddler classrooms in that building, a family child care provider, and enough room for a large motor room, several office spaces. We've already fenced in a playground area over there, so we'll be kind of adding to that this summer. So we're super excited about that. We will be, we've been working with the school district very recently. We're in conversations with the school district to help support and create a CDA class for high school students so that they can have a track to to earn their CDA upon graduation, which will lead to some natural influx of staff into either into classrooms or into family child care. So they'll be prepared for that. So we're pretty excited about that, hoping to start that in the fall. We've also started a parent trainee program where we work primarily now with Head Start parents who might be interested in getting into the field, where we give them an opportunity to work in the classrooms, learn about it, see if it's something they're really interested in, and if it does work out well, then we kind of proceed with training and work their way up so eventually they can be hired on as a teacher assistant and keep going with that. We've hired probably 5 parents so far in the last couple of years. So that's been a successful feeder program, because one of our biggest challenges, and I think everybody will agree with me, is workforce, lack of providers, lack of staff for a whole host of reasons, which I'm sure you guys have talked about at these meetings, but so that's one thing we've really been focusing on, is finding ways to recruit and retain and train staff and folks that are interested and really want to be in the field. And I guess the last piece I could share quickly is that we've also expanded our services into some corporate partnerships. So not only do we provide Head Start, which is federally funded and state funded, so we use federal Head Start funding, state Head Start funding, child care assistance program funding, early learning scholarship funding, and the food program funding to support our rooms. So it's several different funding sources to provide the staff and the care and the hours that we need. But we're looking now and starting to work with businesses who are interested in wanting to help the child care issues that we're facing, because they need employees and employees need care, and you can't have one without the other. So currently we have one partnership with the Brunswick Corporation in New York Mills, so Lund Boats, where we contract and oversee a family child care provider contract for them, where we help recruit and retain the provider, we support the provider, and then in return, Brunswick has some guaranteed slots for employees at that location. And we're currently working with Acumen in Detroit Lakes to start some child care partnerships, a mixed venture of Head Start and Acumen staff, Head Start eligible children and Acumen staff employees there. So I see a trend of employers getting more involved, and it takes a lot of support. I think that's something I've learned over the years. It's quality childcare is an investment, and it's an investment from a lot of people. And I think we're seeing more and more of that, which really makes me excited to see that, and the buy-in from the community, the buy-in from the employers. It really does take a village, and those are some of the fun things we've been working on.
So I'm seeing a little trend here. 6.5 years ago, I started at Northwest Minnesota Foundation, and Leah hired me too. she was on the board. Did anybody else get hired by Leah? So I guess you're stuck in the Northwest Minnesota. So I am the lead at Northwest Minnesota Foundation for the Child Care Program, and Leah was on our board at that time, and I really appreciated her wisdom when we started this program, just getting things going, trying to figure out which direction to take it. And since that time, we now have another full-time child care program person and a half-time person that also does loans and such. So I'll get to her in a minute too. But Katie Gunderson was hired in September, and she was a family child care provider for 23 years. And then got her 4-year degree. She became a child care aware person, and then was the Roseau County licensor for several years before we took her over to our side. So she's got a lot of great experience, and I love having her on my team. So our region, as Leah said, is made up of 2 tribal nations, White Earth and Red Lake, and then 12 counties in Northwest Minnesota. I actually live in Roseau. So we're up there, Kitson County, all the way down to here, across over to the North Dakota border and Lake of the Woods. So we have a big area and not quite as many people as most regions, but we have a lot of great communities that work hard to make things work for us. So we continue to see a crisis in the area of childcare. As you all know, it's why we're here. According to First Children's Finance, we're negative 3,410 child care slots in our region. So we lost half of our family child care providers during the pandemic, and we were actually making a little headway before the pandemic hit, and then people either retired or they just couldn't make it work with families not coming, not bringing their children because they were staying at home, or they just, like up by us, Polaris, Marvin's, they have $4,000, $5,000 bonuses to sign on to work on the line with great benefits, time off, and you don't get that with childcare. So it's a passion, and there's people still doing it because they are passionate about it, but we're losing some good ones too. So we are working on some things with our program, and I just want to highlight some of our programs that we've been working on. So I do have some brochures here if anybody would like to see them later, but this is our child care finance program, and I'll just say I did do a PowerPoint, and so I'm kind of trying to figure out as I go here what I'm talking about. But our childcare finance program was started to help potential new providers open their doors. So there's two parts to it. The first part is a forgivable loan. So if you are a new provider or if you have been in the business for 6 months or less, you are eligible to get this $5,000 forgivable loan. If you stay in business for 5 years, it's completely written off. So you don't pay anything back. So it's written off monthly. So if you do end up, deciding this isn't for me and quit 2 or 3 years in, you just pay off the remainder. So if there's 2 years left on it, that's what you pay back. Tabby Steinmetz is our person in charge of that program, and she does great work, and she's really good to do technical assistance, helping you. There's a one-page application for it. We made it as simple as possible, and at this point, we have given out 110 forgivable loans. We started this program July 2018, and the numbers that the data we've collected is to December 2022. So 110 providers, that equals 1,100 new child care slots. And every county and tribal nation has at least one forgivable loan in it, and several, and with 110 and only 12 counties and 2 tribal nations, that's more than one in each county. So this program is funded through grants and through Northwest Minnesota Foundation Child Care Program dollars. We use our own money too for this. And the dollar amount that we've spent up to December 2022 is $550,000 on this program alone. So that, and it's been successful. I think we've only had 5 childcare providers that have backed away and said, nope, it's not for me. And if it's not for you, great. We don't want you to be in childcare if it's not for you. It's too important. So, so we're getting people started. I mean, if the only reason you're not opening your doors because you can't afford the egress window you need to get licensed, that's what this is for. It can help you get that license. Let's see. The second part of that program, or the child care finance program, is a low interest loan. So that can be up to $35,000 for up to 5 years at 1.5% interest. But if you start Parent Aware, which is the quality rating system in Minnesota, if you start building quality with that program, the interest rate falls to 0.5%. So it's a pretty good deal for those that need to update or new flooring, or children are tough on things. So and that it doesn't matter if you're just starting or if you've been in it for 20 years or as long as Carrie has. Then part of building quality, we believe at Northwest Minnesota Foundation, is training, and so we've funded several different trainings. The Growing Brain is presented by a trained professional from Bemidji Early Childhood Collaborative, and we actually granted them funds to train the trainer opportunity so that they could train early educators, parents, and foster parents in the Growing Brain curriculum. We have contracts with Peacemaker Resources to bring social-emotional learning into Head Start and early Head Start classrooms, training the teachers, the paraprofessionals, the parents, and the children. So they're all using the same words for strategies and techniques on mental health and social-emotional skills. We have contracts with First Children's Finance to offer child care business training, and Michelle will speak to that, I'm sure. And we have a second contract with Peacemaker Resources, and that's for our Step Up program. And we wrote for a grant. It's going to be 6 years now. We wrote for a grant from Blue Cross Blue Shield Foundation to develop a curriculum. We reached out to experts in our region and asked, what is the biggest need? And it came down to mental health for young children and social emotional skills. And so we reached out to Peacemaker Resources. They are the experts in that area. And we asked if they could create a curriculum at the preschool level. They were used to working in middle school. And so we worked with them. We got that done. And now we're in our 5th year of doing this. We have 3 different curriculums. So child care providers can go to these workshops. They develop approved hours, which is hours that help them keep their license. They get a $250 stipend for coming to the training. If they bring in our mental health experts or our social emotional experts into their homes or their classrooms, they get another $250 where the mental health workers work with the children, do the teaching strategies right there in real time, and providers can ask questions and do it right along with them, so they're being coached and learning how to do those different techniques. The second round of, so that's called the foundation level. Then the next level is actually called the next level. We were really ingenious in our naming of things as well. The next level is a training, and that's more, let me look at my quick notes here. That's more on reflecting the values of the provider, and then identifying ways that those values influence their decisions, their priorities, developing relationships with the families and the children, and then also self-care for themselves. And they get develop approved hours for those, and they also get a $250 stipend for attending that workshop. And then the third workshop that we developed is called the Community of Belonging. And that one is a shorter workshop. The stipend for that is $150. And that one is kind of a preschool DEI, diversity, inclusion, and equity type program. And it's a 2-hour virtual or a 3-hour in-person workshop, and it teaches about cultural identity, using our advantages to lift up others experiencing disadvantages. And that's kind of the theme around that one. And then there's just 2 more things I wanted to quick talk about. So alongside our partners, Mojave and Tri-Valley Opportunity Council, we hold child care resource events. We just had one on Monday night last week where local resources are brought in, Child Care Aware, Parents Aware, Northwest Minnesota Foundation, CAP-LP, district office people, First Children's Finance. We all come in, the licensor, we all come in, we do some networking, we talk about what programs we have available for them, how to get a hold of us, kind of get a face to a name and a title so that we're pretty approachable people. So they get to meet us and learn about what we can offer them. So Mojave and Tri-Valley both are doing those, Region 1 and Region 2, fully covered, along with our tribal nations. And finally, I want to talk about one of my biggest favorite things that we've established at Northwest Minnesota Foundation is a collaborative team. When I started in this program, I had a lot of ideas, but not a lot of experience. And so I brought together a team of experts from the region that we meet quarterly. Maria's on my team, Michelle's on my team, Dane is on my team, who would have been here tonight. So we have Child Care Aware, Parent Aware, licensors, county licensors. We have a state licensor that comes in. We have MNTREC, Minnesota Tribal Early Childhood Council comes in, Red Lake Nation licensors, the White Earth Nation licensor. We have the Wayfinders. You guys are going to talk about that later. Our Wayfinders and our Empower to Educate people come. Region 1 and Region 2 come. I have a center director from Pine Pals. She's got an intergenerational program that's amazing in Bemidji. And then some county licensors too that come in. We all kind of just talk about what's working, what are we seeing that's happening where we live, how can we help, and try not to duplicate efforts with the funds that we're getting. And it's been just an awesome experience to work with these ladies that they have great ideas. We do a lot of brainstorming. We just finished our strategic plan, and we'll start implementing that action plan now. Starting in January, we're going to finalize it and approve it, and then watch us go. Thank you.
My name is Krista Livermont, and as you heard, I'm not Dana Patsy. I was actually hired by Dana Patsy, who was probably hired by the So we have that connection. And I am the rookie on the team who is really slow reflexes. So when they were playing nose goes about who's going to sit here tonight, yeah, I lost. But it's okay. It's okay. I won. No, I'm happy to be here. So I am a child care quality coach for Parent Aware, and I work with Kathy, who is also for this region. I help out with Region 5 also, which is Crow Wing, Cass, Morrison, Todd, and I think I'm missing one county in there. And then Kathy and I do Region 2. What was it? Wadena, thank you. Yep. And for those of you who aren't familiar with Parent Aware, we work alongside providers that ask us to come and help them, coach them through some of the best practices in early childhood, trying to just teach them a little bit and be a sounding board for them, maybe show them what we know. Kathy and I have both done family child care for many years. Actually, Sarah has too, our Wayfinder. So yeah, we can kind of work together to collaborate with the child care providers. And it's really about helping kids prepare for kindergarten and using those best practices. And then the child care providers can also choose to go through a rating system. It's called a star rating. And they can choose which star rating they would like to work through, 1 star to 4 stars. There's a grant that's attached to that. So while they're learning, they're also earning some money back eventually too that they can put towards their program or their equipment, or which is part of their program. All in the process of helping them learn and get some funds for their program. So one of the questions we were supposed to answer is, do you offer funding or support, and technical assistance for childcare, and that's kind of what I was just talking about. As far as the star rating goes, there's, like I said, there's different levels, and with each level, the rigorousness of the program gets a little more, increases a little bit more. We're wanting to help providers with not just how they educate their kids and taking that education seriously, because they are their children's first teachers, but then also the relationships that they have with their families, how they observe and assess the children that they work with developmentally, the professionalism that they use as an educator, and also the health and safety practices that they use in their program. So that's kind of what we coach to as child care coaches. And as far as other grants and things that are available, there's some through DHS that we work with. Kathy has brought some materials. We've got the Teach Scholarship, which is for educators to be able to work towards higher ed degrees. The Retain Scholarship, which is helping them stay in business, basically. Stabilization grant, I think, was geared towards just some of the after effects of COVID and how that affected businesses, and then the revitalization grant to help them with whatever daycare is hard on business, hard on homes. Yes, and Michelle can speak to that too. And then our agency also has a program called the FFN, which is Family, Friends, and Neighbors. And that supports people in our community who step up to help family members or friends to provide care for a child. And they recently partnered with Head Start in our community to host a grandparents group, which I think is the coolest thing ever. So we all know that there are not only parents that are not having a hard time finding childcare. There might be parents that maybe single parents that want to increase their education, but they don't have the means to pay for childcare and tuition. So there's situations like that where parents, neighbors, friends might be stepping in. And I know on our last panel we had one of the providers had just started working with Sarah as a Wayfinder client and was in the process of getting licensed. And the reason that she started to get licensed is because she realized that there was such a need for it, and a friend of hers was in trouble, not able to find in-day care. So this friend helped her friend out by providing childcare, and then realizing that, hey, you know what, this might be something that I want to do. And so, anyway, that's kind of what FFN does. And we have an event coming up on Monday. I think we've got resource materials somewhere about that, and there's flyers up everywhere. Sarah and I probably put up 50 flyers on last week. But that is going to be happening on Monday to just provide a little bit of support for those FFNs, those people that are taking care of friends, grandchildren, nieces, nephews, whatever, but it might just be a situation where it's the only child that they're caring for. So they aren't necessarily getting licensed, but we want to still provide a little bit of support for them. So we've got that coming up. So another question was, what are the greatest challenges you see in terms of recruiting, training, and retaining child care providers? And we touched on that a lot in the last panel too. I don't want to go into it too much because I don't want to discourage anybody that's thinking about doing childcare. But there are difficulties. Childcare providers work really long days, no breaks. As a childcare provider, an in-home childcare provider, I had to discourage myself from figuring out what I was actually making hourly because it was depressing. You just don't want to do it, but at the same time, I had the benefit as somebody who went into child development career-wise. I had the benefit of being home with my own children and raising my own children, and having my children's friends there too, and helping to take care of them and helping out friends that needed those child care spots for their kiddos, and so. There's a lot of benefits that way, and I don't think I would trade that time for anything. Obviously, a lot of us go into childcare for that reason, and it's an awesome benefit. I mean, not everybody can stay home with their children, but I felt very blessed to do that. As a childcare provider, your income is limited by your enrollment. So that can be an issue. I mean, you're obviously going to have a ceiling of what you can do, and that ceiling is also determined by what you can handle during the day. If you have the capacity to take 8 children, your licensure says you can have 8 children, 2 of them are yours, and you think 6 other children in my house all day. No, thank you. But you can't do more than that. So you are limited as to the income that you can make. So that's kind of a bummer. And in most cases, a child care provider would need, a home child care provider would need to own a home. And when you're talking, I am super excited about the idea of high school kids moving into this season and getting their CDAs, and that's wonderful. Wonderful, especially for child care centers. For in-home, they need a home. They need benefits. There's things that they're not getting that any other business or anybody else that's working in a business would receive. So, I mean, like I said, there's situations that make it more difficult, but at the same time, there's benefits too. As far as training, continuing education is something that's necessary for child care providers. It's part of licensing requirement. If you work in a center, it's part of the licensing requirement for, they have to have so many lead teachers, they have to have so many aides, assistant teachers. And they need to have a certain amount of training. I'm going to tell you that back in the early 90s when I started in child care, and I was in Brainerd. So I was in Minnesota. I just moved here from North Dakota not too long ago, so I'm going back way far. But what training looked like for a child care teacher, lead teacher, or a director was that we needed to get 40 hours of training a year. There was CPR and first aid was part of that, so that maybe took 8 of those hours. And that's something you could do locally, but anything beyond that, we would have to drive to St. Cloud, we would have to drive to the cities, we would have to give up our weekends, we would have to take unpaid days off or take a vacation day to get that training. And there was no internet training. It feels like the dinosaur era. Moving back to Minnesota now and seeing all these awesome resources that are available to child care providers and to help people that choose to, especially people that choose to stay home and raise their children and raise other people's children, actually feel like they are part of a profession, which they are. But before, 30 years ago, 35 years ago, they were babysitters. Now they're professionals. And they've always been professionals. It's just that now we're treating them like professionals. So it's amazing. My mind has been blown by seeing some of the resources that are available to us now. So that's been amazing. Let me see, I better move on here. As far as what needs to be done or changed to improve childcare services in the Park Rapids area, I think, and these are Dana's words too, just that continued and increased recognition of the role of childcare to the community, because as they were saying earlier, I mean, there's not business without childcare. They have to go hand in hand. So we need to recognize the fact that we need childcare, businesses need childcare, and hopefully some of the bigger businesses in our area will start to recognize that a little bit more and see what can be done to move towards that, so that we don't have much for childcare centers in town. Is it one? One? Yep. Could probably use more. And infant care is so difficult to come by. And then having a continued and increased understanding of childcare as a community business. So those are really, I think, the big things that we need to address. But we really appreciate the League of Women Voters for putting this together, and feel like these meetings are just one more thing that's kind of helping put resources or I shouldn't say the resources, but just getting the wheels in motion and helping us move forward. Thank you, Marina.
Can you hear me okay? So as Leah said, I'm Maria Steen. I wasn't hired by her, but I do work for a neighboring community action agency, and I am grateful that I found my space there. In addition to being the director of our childcare programming at CAP-LP, as you said, one other thing that is important to know about me is that I am a single mom who was very reliant on childcare in its many capacities. As Krista alluded to, it's a complex system, and there is no way I would have been able to make it in a career without two very near and dear to my heart family childcare providers that my son used, as well as several family members who were very key to making it, including my uncle who's sitting in the audience here. But my son spent some really quality time with my aunt and uncle when I would need to travel. I didn't have parents in the area who my son could stay with, and he was able to stay with them. So childcare it's a complex setting, and as when I very first entered into work at Childcare Aware, my first job was to help families find childcare. And one of the things I would always talk to them about is how when you're looking for childcare, you're really truly trying to find somebody you're going to partner in raising your kids with. In all honesty, they spend a lot of time with those very key people, and so and there are a million ways that childcare can look like quality. It depends on the family, and it depends on the provider and what they're doing. And so you really are trying to find a match for somebody you're going to partner in that raising and rearing and caring and learning. Because if it hasn't been said yet this evening, we know that 90% of a child's brain development happens before they get in those doors for kindergarten. And so that's why it's so important that we get them off on the right foot. So at CAP-LP, our Childcare Aware site is known as what's a district site for Childcare Aware services. So if you have heard of childcare over the years, once upon a time we used to be known as a Childcare Resource and Referral Network, and it is for over 30 years. It's a nationwide network of agencies that do things. Their services look a little different in every community, but essentially we're there to support the professionals that are doing the work and support parents in finding care, and then to help communities and businesses know about why childcare matters. And we've hit on some of those main points. But So our agency, like we said at the beginning, we serve 21 counties and 2 tribal nations, all the way up to Canada and down to Pope and Stevens and Traverse County in the southern part of our territory. And we have a lot of the same services that Hubby Ottawa does for childcare, for parent-aware rating. But I think for our purposes here, one of the main things that we do in Hubbard County and Park Rapids is to provide kind of 3 key district services. So one of the things we have is our grants program, and almost all of our funding comes from the Minnesota Department of Human Services, which trickles down much of it from the federal government through a block grant. But so the state decides how much money they're going to give to each region or each district, and then we have grants committees that help us decide how we're going to divvy up that money. But each year we have funding, and Missy kind of mentioned it. So our district covers 3 regions. There's Region 1, Region 2, and Region 4 that breaks up those 21 counties into smaller areas. But we have grants available, and so if you are interested in starting childcare, one of the wonderful things, again, like Missy also talked about, is our partnership. We have startup grants that can help get you started. So we can pair those with the Northwest Minnesota Foundation grants, and those are available throughout the year. They can also be paired with the local Wayfinder. We have startup vouchers available, so if you are working with Sarah, she's got some funding available to help you. So we can put all that together, and even probably with what Michelle talked about a little bit too. And then as you are in the business, we also offer annual regional grants that are competitive grants, but family child care and licensed centers can all apply for that funding. Every fall and September we have grant rounds that open up, and those are things to help maintain child care businesses, and folks apply for those. We have kind of workshops that now are all held online to help people fill out that. And then I think a little known fact though is that we also offer emergency grants. So as things come up, we have had people whose basements flood or their water heaters go out, or things that you really need. You wouldn't be able to stay open. We had unfortunately a fire in the child care program, and we were able, she is the gal who had a fire, was waiting on some insurance approval to come through, but in the meantime we could get an emergency grant out faster to her to replace some really needed items. So that's one of the things. Another piece, a big part of our work across the district is planning trainings. As Krista was talking about, every child care provider has to meet training requirements, and so we have been one of the main delivery providers of trainings across the district. We have, for all the time we've been in business, have really specialized in face-to-face training services. So I forgot to share. Over this past year, we have had issued almost $39,000 in grants to our child care providers across Region 2 that you're in, but 7 of those have gone to Hubbard County providers. For Regional 1, we did have an emergency grant and a couple of startup grants too. But the trainings that we plan are all across the territory, and that's something I think whenever I get a chance to go into groups is to be able to share that. I have a team of people that do training, planning, and they're mostly located in Moorhead. But the more you get to know our training person, the more we want to be able to plan responsive training. So if there are topics that you want to know about, or if you want to be involved in helping plan, if you were letting us know, well, when would be the best weekend to have a Super Saturday training, as we call them, where you can get 6 hours of training done in one day. We are all ears and want to know, knowing where the best locations are to have trainings and things like that. So, in this past year, we held almost 200 trainings across our district, and 7 of those were held here in Park Rapids. We also train, we hold trainings in Detroit Lakes and Bemidji that I know some people go here or there for. And then there's 4 coming up this summer. But part of what we do is publish a training calendar. Well, it's not published per se anymore, but we put out a training catalog of all the trainings across the district. So the other program that is kind of key and is very new to our work is what we call Empower to Educate, and that's a specific workforce advisor that's housed, well, she's housed in Greenbush because she actually lives up there, but she works for our agency, and she can meet with folks who are interested in exploring childcare as a career to help them just kind of navigate, like, well, what are the trainings that I need to take, and how do I even go about finding these, and maybe you want to work towards a certificate in our field, what's called a CDA, a Child Development Associate's credential, is a nationally recognized credential that a person could take from state to state, and people recognize that as a valid certificate. We can help people on that pathway. But the cool thing about Empower to Educate is that there's some stipends available for folks. So whether you're new to the profession or are wanting to pursue more education in the career, you can, once you sign up for the program, there's a $300 stipend. And then if you follow along with the requirements and just meet with the workforce advisor for 6 months, then after you're done, you get a $600 stipend. So kind of a little way to help you buy equipment. If you need a computer to get your business going, that's a great way to do that, and pay for some trainings, but that's your money to spend. So, yeah, another one of the questions that people talked about were some of the challenges, and I don't need to probably beat a dead horse about the fact that it is a really especially for family childcare, it's an isolating job, and I think that we really need to be creative, perhaps, about coming up with some new models of way and things that that we can do through partnerships, or so that there are ways that people could maybe do this business but not have to do it all alone all the time. But unfortunately, the funding system for childcare isn't really the best. It's not like you can't make, like you said, we can't put more kids in a room because that's not safe. We want to make sure that we're amplifying that this is safe and the best place for kids, but you can't just keep charging parents more either, because they get priced out of the market, and then it's not the best business funding model out there. And I think there are some great potential ways. We've been trying to take a stab at that through the child care stabilization grants that I almost need a pun there because they have been referred to as the STAB grants, like stabilization for short. But so I know we could go down that path if people have questions about it, but I won't get stuck there. So I think one of the neat things about having community action agencies here and foundations and really great partners all around is just for you to know that, we, again, at the heart of community action, we really want to be about helping, we're in communities and trying to help solve what the community says are problems. So how can we go about working together on that? One thing we're doing at our agency is the state had a really tiny pilot program, and so we applied for that and went for it, and we're testing out in a neighboring county of yours a sub-pilot program, so that the idea behind it is that we could help family child care providers be able to get out without having to close their doors, but have access to an affordable substitute or a second set of hands, so they can even book them as a second caregiver. But we are taking care of the licensing fees and the training fees and offering it at a subsidized rate so that it's an affordable choice. And we are having, it took quite a while to get it off the ground, but the folks who have started using it are just so grateful because it's helped with medical appointments. It's allowing them to, if they just need to take a half a day so they can get to go see one of their kids' school programs, because that is something you can't do unless you can somehow manage to haul all 8 of your kids, which I know some people do. But so that there are ways to be innovative. I think the key is to listen to providers and hear from them about what it is that they want and what will be helpful. I think in some communities, it's, figuring out ways to make those trainings accessible and be the trainings that they want to see and hear, and maybe figure out a way we can provide food and at a charge, so that they don't have to be charged for it. I know that one of the hottest topics is about how to help people find childcare, and so we don't have I don't want to undersell myself at the beginning, but we don't necessarily have the best system, but I do want to make sure people know about what's called parentaware.org. So we've thrown around the parent aware terminology, but in addition to being a rating system that helps, support the professionals doing the work, it's meant to be a tool to help families find childcare. So if you go to parentaware.org, you'll come to a search page that allows you to, I tried to pull it up in advance so I was ready, but you can just type in Park Rapids, Minnesota, and it'll come up with the list of all of the licensed programs in the community. You do have to select on a filter so that you can, it defaults to trying to find people within a 25-mile radius, and probably most people don't need to travel that far. But you can monkey around with filter settings on there, and you would be able to find, you can determine, you got it, yeah, I have. So if anybody's wanting to walk along with it, but, thanks. We are good friends here, so it will, it's going to default to showing people to by, it does filter with the star-rated programs towards the top. It constantly rearranges them so that it's not the same person that'll come up there, but the neat thing about it is people can create a profile on there so they can tell you a little bit about their program. They can tell you the hours they're open and the ages of kids they care for. And there are even people who are using it to post their openings. So it is the tool. So lo and behold. So what I would like to see us, and I think what we've been having conversations about, because your community brought this to the forefront, I think we would really like to see some more ways that we in the field can be trained on how to help providers use the tool, because it's not the easiest thing to do, but there are ways that people can go in here and create their own profile, and then they could post their openings on there. And if we had people using the tool, then that would be the best way to go about finding, where people can find care. I can't solve the problem about needing to call all of the providers, because I will tell you, it is an important thing for people to take that step. It does feel like a lot of work, but I think sometimes people put more work into searching for the cars that they're going to buy than they do for searching for care. Because as I said at the beginning, you're trying to find somebody that you're going to be in a relationship with, essentially. So on this website as well, there is a downloadable toolkit that can help parents walk through, like evaluating what are the things that are most important to you when you're looking for childcare, and what are some questions that you can ask those people. I mean, obviously one of the things you're going to start off with is, do you have openings for my ages of kids? But beyond that, you want to know more about them and what's their philosophy on what they're, what they plan for their day, and how often do they take kids outside, and are you close to a park, or what, those kinds of things. So the good news is there is a tool out there, and if we can find ways to help more people, more of the providers who are the licensed programs that are on here, if we can be helpful in helping them navigate that tool, then I think that would help, in turn, the parents that are looking for care. So that is what I wanted to share.
Okay.
Thanks.
Well, I'm talking about First Children's Finance. We work with on 3 different levels. So we work with the individuals with one-on-one consultations. We do technical assistance, and then we have funding with grant programs and loans to offer, and we also offer free training on the business side. With some of our training, we have the business leadership training, which is a series of 4 trainings. At the end, the provider gets a credential, which is they can use towards their parent aware rating. They get 3 credits with that. They get develop approved hours, and they get a chance at a grant of $1,000 for family child care, or up to $2,500 for a center care director that they can use for their program. So maybe they need a new laptop or something for their child care. That grant is great. And then we have the revitalization grant, which is up to $15,000 for family child care providers and $20,000 for child care centers. So let's say a provider got a grant for $10,000 to fix steps and maybe some flooring. And then we've been doing grant runs every 3 months. And so they could use that other $5,000 to fix their fence or something. So the lifetime would be $15,000 for the family child care provider. On the community level, we provide customized consultation and a variety of programs and services designed to assist communities to increase the supply of childcare. And then at the state level, we advocate for policies and funding that impact the sustainability of childcare businesses. Our funding sources at FCF, we're a nonprofit, and we're supported in multiple ways by multiple funders, including DHS, and we partner with Northwest Minnesota Foundation. All of our work can be accessed anytime, and there's no set level of funding for each county. So I work with all 12 counties in our Northwest region and the 2 tribal nations as well. Numbers, so we work with all types of childcare businesses. We work with startups, existing family or center-based programs, and we also help the family, friend, and neighbors. So with a revitalization grant, if you're a family, friend, or neighbor, I think that grant is up to $500 to help them with their facility as well. What types of childcare services do we fund? And we fund all business types, for-profit, nonprofit, school collaborations, and faith-based programs. I know we've worked with a few faith-based programs that were like, we can actually apply for this grant. Are you kidding me? Yes, you can. So they're very excited about that. What are the greatest challenges that we see? Again, workforce is the biggest challenge. We do our business leadership cohort. I was in a couple with center directors, everyone across the state. It's the same thing. We actually lost the numbers of the directors that could even attend, because we normally do our trainings during the day for directors, and they had to be in rooms. So they're like emailing us, we can't attend. I have too many staff missing. I have to jump into a room. So we're looking at, do we do center trainings at night? I mean, so they're working all day and then they're training at night, which our family child care trainings are during the evenings. So, we try to accommodate everyone with our free training, and all of that is available online with the Zoom platform, which was something I had to learn. Oh my gosh, that was fun. So we fund, and what are and we talked about workforce, definitely. And the challenges that we see with licensing. So the issues that we see from the business side is that there's some unrealistic business plans. So we talk about what cash flow will be and how to sustain that business. And in the Northwest region, we collaborate as a team, which we've talked about. And that really helps too with that licensing process and the regulations, because it varies with childcare centers and family childcare. So it can take up to 18 months to license a center, sometimes longer. But with a family childcare, you can be licensed within a couple months. Regulations, especially with childcare centers, are rigid, and historically all the state licensors have been located in the metro. So having a relationship with the licensors is difficult, especially for startups, because they normally have someone that does the startups and then they go to a regional licensor. And I think they're trying to get someone that's more regionally assigned for the state licensing. And I really love our county licensors for rural too. I mean, that relationship that I know as a family childcare provider to have with, you can just call them, hey, I have a question. can I get a variance? And they can tell you that day, where when you're center, it can be emails, calls, and you're still wondering 2 weeks later. So, is there a way to help parents and guardians find available openings? Please use Child Care Aware. I can't stress that enough. That's what it's there for. And I have seen on Facebook, there's regional or community groups that will post their openings. So social media has been a help too, but definitely Child Care Aware. And then what should we do to improve childcare in the Hubbard County area? So in my experience, the Rural Child Care Innovation Program that we have at FCF would be the best process to have a thorough analysis of the community's current childcare gaps and needs. So it's a great way to find the right size solution for the community, and then we can figure out what's best for your needs. We do the state childcare needs summary, which we talked about. But then when we do the community work, we send out surveys to parents, providers, and employers, and we try to get at, what exactly Hubbard County would need. Everyone thinks, well, no one does nighttime care, but then people try to open up a nighttime, and no one uses it because they will get grandma or they will get an aunt. So then, it doesn't work to stay open that late. Anyway, so it's easy to stand by and say, well, this is what they need. But until you talk to everyone and get everyone at the table together and then assign, tasks to a goal and have people put their name on it and the follow through, then we get things done. So that's my 2 cents on that.
Okay.
My goodness, some tremendous resources. Thank you for sharing so much. But we want to hear questions. Certainly there are questions that you have about the resources, how to access those resources, what does funding look like in the future? Questions?
Missy, you estimated 3,400 child care slots shortage in your region. If you drill down on the Park Rapids area, what is your estimate?
I got that number right in front of me. And actually, these numbers are from First Children's Finance and our partnership, so she's probably going to find it before me. But Hubbard County is down 220 slots. Park Rapids, the actual community, is down 47 slots. And actually, you guys have gotten better since 2020. 2020, it was 300 slots for Hubbard County and negative 123 for Park Rapids.
Okay,
So.
thank you. Sloan, I'm reluctant to give it back to Leah. Michelle, is that analysis that you do on a local, on a community basis, would that be free?
Yes, all of our community work is free.
Kristen?
I have one. It sounds like, do I need this? Probably not. I've been told maybe my voice is too loud, but it sounds like the whole child care industry has evolved over the last 15, 20 years, maybe even shorter than that, where grandma would take care of the kids. I mean, that's the world I grew up in. But has there been any effort to look at how some of the European, specifically the Scandinavian countries, what kind of model they use for child care? Because they must have the same kind of issues and problems and complexities that we do in northern Minnesota. So how do these countries that supposedly have the happiest lifestyles and the best way to living in the world, how do they handle their child care?
They fund it.
They do.
The government funds it. They're, like how we're funded K-12, pretty much, they fund birth
Yeah.
to age 12.
And most of those countries also have parental leave.
A year.
A year of parental leave, so they don't have the infant concern, which is our biggest concern.
I was gonna say, the biggest concern is
Yeah.
the infant care.
And they have
For
parental
sure.
leave for that.
We actually had there was a a scholar from Finland who came over and did research in Minnesota to learn about, you know, how we do childcare here and that was one thing. She was like, wow, you know, to hear all the different pots of money, all the different programs it takes to try to provide early childhood services in the state, which is pretty much how it is across the country. She said it's just, she's like, why don't you all put your money together?
Right.
To serve the kid, because in Finland, it's all one pot. And every kid has got the same access to that funding. And she said there's a little bit of sliding fee, so if you're really, really wealthy, you might pay something. But for the most part, it's universally provided for.
All right, and this, I don't want this question to sound challenging, but it is. So, with all of the talk in this country about the sanctity of life from politicians and different interest groups, does the sanctity of life about childcare or the crisis about childcare ever reach that same level when you're dealing with the funding agencies? Do they share the same interest in providing good childcare as they do for trying to apply other values to family life?
Are you speaking the corporate world or the political world?
Political world. Well, of course, both worlds, but
I think both corporate and political, I'd say, it depends on who you're talking to.
okay.
I mean, I think that I truly believe there are people that are in higher, that are political, that believe what we're saying, that it's important, that this stage of life is important, but
There's more talk and more support at a political level now for early childhood programming than there's ever been.
Absolutely.
Well, that's
Because that has
Going in
greatly
the right
changed
direction.
even in the time that I've been here. So
And don't
there's,
you think that's based on, it's starting to affect the
It
bottom
is.
dollar?
Yeah,
It's starting
it's
to
affecting the
affect the
businesses.
corporate, the business world. And so now it's starting to come to the forefront how important early childhood and childcare providers really are to this world. We already knew that, but
yeah,
now it's starting to affect people that
aren't
they can't
necessarily in the
get, they
field.
can't get staff.
Right. So the conversation has a lot more traction now because businesses are interested in it. But we can't, I don't think any of us would disagree that it is also so core to remember that the value of early childhood isn't just about, that these are our kids who are part of our future workforce. That, like, early childhood has a value in and of itself. It's not just that they're getting ready for the next stage of their life. That when we do it right, it just, it has value in and of itself. And it has long-term, we can talk about all of the return on investment that you get when you invest early on, but these are human beings who are living part of their, very fundamental part of their life, and that's really important too. And the other thing I wanted to say is that there actually is a proposal in the House, at least on the House side of the Minnesota, some of the omnibus bills that are working on funding, and they are actually trying to put forward braiding of the two main sources that currently fund, that help support families, and try to make sure that more families can access that funding. So, I mean, Minnesota has been trying to do some innovative things, and we have, but the goofy part is that right now there's two separate pots of money that people have to apply for separately, and there's different qualifications, and then providers that use them have to draw that money down separately, and they don't get paid for doing that. They do it to get paid, but there's nothing extra for all of that work, so.
Yeah, in Park Rapids, everybody and their grandmother knows that we have a childcare crisis. Team industries, RDO, banks, churches, other civic organizations, city, county. So what are the barriers that are preventing all of those people from stepping up? Not only just here, but region-wide. I mean, everybody gets it.
Right.
I mean, you would have all those people in this room, and none would be shocked.
Right.
So
I think that the thing is just getting everyone together at the table at the same time and then working together as a team. You can talk about it And then at the end of the day, if nothing's done, you just sit and spin. And people get sick of it and then leave their job or whatever. But this is where I think our CCIPs just have really made traction.
I'll add to that a little bit. I'm Dave Delahunt, Hubbard County Commissioner. I also serve on the Heartland Lakes Development Commission. And for the 4 years I've been on the Heartland Lakes Development Commission, we've spoke about this issue a lot. And ultimately it all comes down to how do you make the economics work? And you have two choices. You can either, you've got a supply problem, so you either have to, A, create an environment so that people want to solve or get into that market, which will solve the supply problem. Make the playing field conducive enough that people that will want to go into that business and can be successful at it. Okay, that's hard to do with all the regulations and all the training, and you guys have talked about this probably 100 million times. And under the current political climate, I don't see that changing. The other option you're going to go down the route is subsidizing. Okay, you can subsidize it with tax dollars. You could have the city or the county build a daycare center. But ultimately, you build that building. If the economic model doesn't work, you're going to end up with a dead building. It's going to end up empty. Whoever you put in there is going to find out they can't make it. And now the county or the city or whatever government entity did that is stuck with a building. We've all seen that story happen a lot on a lot of different things, whether it's sports arenas or whatever it might be. So we always arrived at that, no matter how we talked this out. The most successful model there was the home-based daycare model. But when the regulations come into the point where it drowns their ability to make it successful or make a decent wage doing it, it's really hard to find people to enter into that. So I don't know what the answer is. Probably some combination of both, but I keep batting my head on it and talking to my senators and representatives from the state of Minnesota until they're willing to look at the regulations and do a deep dive to what regulations really matter for safety and what ones are just so burdensome that we can pare them down. Maybe you can come up with some model of government-private partnership. It's easy to build a building. Government can do that lickety-split. That's not that hard to do. We could have a center built tomorrow. But are you going to have anybody in there that's going to operate it? That's going to stay? That's the struggle. And it's frustrating. I get it.
Carrie, I have to ask you to respond to that. Carrie is a very successful, very experienced, long-time family child care provider, and she knows the formula. She knows it.
I was actually just going to say, can you hear me?
It isn't working.
Do I need it? No? Okay.
Speak to us like you would to your
I was going
children.
to say, I did that for 10 hours already today. You hear my voice, it's already a little scratchy, but, so I will say that they actually are in the process of streamlining our regulation process, because we currently have to follow Rule 2, which is 9502, if you want to look it up. And then also, there's a lot of regulations in 245A, which is the Health and Human Services statutes. And so they are in the process of working on kind of modernizing some of those things, because there are some very, very outdated things that we have to follow. So that is happening. I actually have in my email currently, it's a 40-minute, they figure it'll take us 40 minutes to go through, and child care providers and whoever else are sending it to, we have to pick apart these 100-some rules that we have to score them based on what we feel are necessary for health and safety and are not necessary for health and safety. And from there, hopefully they will streamline some of them, eliminate some of them. Maybe there won't be correction orders for holding an infant, because that is a thing, because we are not allowed to hold a sleeping infant, in case you're wondering. That is an actual rule. We are required by law to put a sleeping infant in their crib, and it has to be in a certain setting, whatever, as soon as practicable. But that could be interpreted in many ways. And there have been providers who have been issued correction or negative action orders and had to pay fines because they were at a park with 5 children and the infant was asleep in the stroller. So that's a real struggle. And so when people wonder why providers won't take infants in childcare, that's one example, just one of many, many, many. But the good news is they are working on some of those things, and hopefully we'll see some positive change as far as the rules and regulations go. When I first started as a family child care provider, I've worked in early childhood since 1989 in some way or another. But when I first opened up my family child care, it was a very easy process. It was, the fire marshal came, everything was good. You did a couple trainings. I think we had 6 hours that were required back then. Granted, maybe that was a little light. And really that was it. You had to develop your policies and you got your license. That was pretty much it. And I developed like my own policy and procedure handbook based on what our regulations are. And that was like a trifold front and back, like that's what parents were given. It is now 14 pages long. And it is 14 pages long now because as they issue us more regulations, I then have to create a policy so that parents understand why a policy is a policy. So it's just a whole ricochet effect. It goes down, and that's kind of where we're at, and it's the reality of family child care. So hopefully we will see some positive changes moving forward with the legislation and DHS and this survey. I started it. I quickly realized I did not have the time for that, and so I have to go back and finish it because it's a very intense survey. I'm doing it, but it's not easy. I got about 5 pages in, and I was like, "Whew, this is heavy. Okay, I need to close this out and go back to it. I have other things to do at my quiet time today. I have dishes to do." And so that's stuff we have to do, after hours as well as our trainings and all that stuff. So, I'm at my daycare for 10 hours a day minimum. That doesn't include grocery shopping and activity planning and all the things. It's a tough job. One I love it, or I wouldn't still be doing it. But it's definitely not for everybody.
Not for wimps.
I just want to be clear here too, at Heartland Lakes Development Commission, we've done, real small things like you folks are doing.
There was a
We've given
bigger
some
one.
money to.
First Children's Finance did already do one in our community
Yes,
a
I
few
believe
years ago.
That was the
That's
strategic
correct.
planning, it
There
wasn't
was
our
a big one.
CCIP.
Yeah, it was a different one.
It was a smaller level.
Smaller level,
And we're-
okay.
We want to do those things, but those aren't solving the systemic problem. They're just a Band-Aid to get them through or keep them going in the time being. I don't think there's a government entity that's not willing to partner and provide funds, but it has to make sense. It has to be a model that makes sense and is sustainable. Otherwise, nobody's going to dive into that until that happens. And so we've racked our brains trying to figure this out. And maybe there's one out there. You mentioned faith-based. Maybe that's a solution. Maybe it takes 3 partners to make it work.
I was on the governor's task force. It doesn't seem like that big. I was on the governor's task force, and we talked about how rural Minnesota needs a different model than the cities.
Yes.
The metro, the way they do their childcare is centers, and they're big centers, and they're amazing, awesome, but we don't have the numbers to throw centers into every community. You can't sustain them.
Not only that, you'll lose your family child care. I mean,
Right.
if you
Exactly.
think about where, from my perspective as a family child care provider, if I have one infant, which is all I can take if I fill up, there's different scenarios on how many of each age group you can have. But then you've got, free voluntary pre-K. So then, our school also then has childcare available for those preschoolers. So that leaves like a birth to 2 window for family childcare, and we can only have 3 of them. So there's all those scenarios and all those things so then they're taking those spots, so that leaves birth to 2, because you can send your 3-year-old to preschool. And then they have childcare at the school, actually I think our childcare is only for 4, but So there's all kinds of things. It's not just a cut and dried. It's very, very gray. There's no black and white solution. It's going to take a lot of brainstorming. A lot of people need to be involved in order to find a positive solution that's really going to work for everybody.
And I know one of the big things before was if you did it out of your home, there was a significant tax break that you had for getting on your, I don't know if that exists still or not, but now,
Tax break.
what
We can
provider
write
that
off
can get that tax break in
business
their
use
home
of
is
our
gonna move
home,
into a
but-
center, now lose that break, and now it's even more difficult to make it.
Not really a tax break. We can deduct our expenses, we can deduct business use of our home, but we still have to pay self-employment tax. I pay in between 5 and 10 a year probably, roughly, that's my pay-in, so I mean, it's not, that's not good.
You know, I appreciate Dave's comments, and they really echoed Maria's back here, which is that, and you were very kind on it, but, you said the business model is terrible.
Yeah,
It is, it's horrible.
And
It's broken.
I guess, to turn it around and try to make it a little bit more positive, so let's say we came to you guys up there, and let's say you had a coalition of civic organizations, churches, and businesses, and they said, darn it, we want to do something meaningful to change the calculus on the business model. Brainstorm, think out loud with me about what that might look like.
Well, Michelle, over there with Head Start and your pod
And
situation,
the pod
I think
models.
is very innovative.
Yeah, so we've, and we've done a lot of, and I totally, when you said maybe it takes 3 people or 3 groups, I totally believe that. I've been to, well, all of us have, but I've been to many of these community meetings, and it's the same issue in every community, and I think some of the innovations we've had and some of the partnerships we've created, and it looks different in every community. So like, one thing we've been able to do in Detroit Lakes, but, we partner now with, well, we're working on when we're full, when we have all of our partnerships filled, we'll have about 15 providers, but we got 15 different locations, so providers also don't have to do it out of their home, which some people love to do it out of their home, and it works well for them, and other people don't, or they don't own a home, but they want to do childcare, so that's another way to get more people into the field, because some people are renting, or some people just can't afford to buy their home, or they don't want to have it in their home, or their home, it's got too many improvements to make to be licensed. So those are things like what has become known as that pod model, is where we've been able to house, up to 4 providers in a single building in 4 different rooms. So they own and operate their own family childcare businesses in 4 separate rooms in the same building, which then can combat the isolation. It offers some camaraderie. It gives them a sense of, they get to go to work and go home from work, like a lot of people do. If they don't want it in their home, they don't have to have it in their home. So that was one, but even in like New York Mills, that community was really struggling. Providers were leaving that community left and right. They were either retiring or leaving the field altogether. And it took the city and the EDA to purchase a house and had the property. They had a vacant lot, and then the city administrator, she sought out and got like $250,000 in grants to remodel the house, and it created a duplex for 2 providers.
That's a great idea.
And then,
And there's a special family license
and then
now.
so then we've got actually, the partnership we have a Head Start partnership provider in one part of the duplex. The other side of the duplex has our Lund partnership provider. In that case, we're involved with both because we administer the Head Start partnership, but then Lund is a corporation. What I also hear when I go to community meetings is a lot of businesses want to help and they want to do something, but one, they don't have any idea what to do because they don't know anything about childcare, and they don't really want to because they got a different business to run, so they don't want to get into the childcare business. So if they can find partners, whether it's faith-based organizations, whether it's Mahaviatwa, whether it's private childcare providers, because if they can come together, and then Lund also helps, one thing they do to help the business model is they pay for vacant slots. So that's something Head Start does, with our providers. If a child drops, we pay for that slot for 30 days so that the provider's income can stay steady. Lund Boats does the same for 2 weeks. It's a little shorter window, but that's one piece of that economic window helping to be closed. The city owning that building pretty much free and clear allows them to charge a minimal amount of there's really no rent, it's enough to cover the utilities and the taxes on the building. So one provider's paying $250, you know, each side is $275. So for each side of the duplex. Head Start helps supplement one piece of it, but even at $275 a month for a space, that can be reasonable for a provider, because they can't, you know, if you don't own a home and you're paying rent, but you want to do childcare, and the one thing stopping you is, well, I can't afford to buy a house and have a mortgage. So those are just some.
Can I just add one thing too? One of the issues in Hubbard County, Park Rapids specifically, that I know about is infant toddler care, and there is a specialized infant toddler license.
Yep.
So, which allows more spaces because you only take infants and toddlers. So if somebody was willing, that would not be me, that is not my strong suit, but if somebody was willing to kind of take on all those regulations and only have that you get a couple of those in a building, it'd be a huge difference, you know, in
Businesses were willing to help support.
Yes.
Because
Yes.
it doesn't,
Yes,
exactly.
Then the ratio's too small and they can't.
your ratios are very small, so yes, it doesn't cash flow, but that's where it would be nice
But
if
if you
Yeah.
had
a business that would
was
be willing
willing
to, yeah.
A couple other ideas just to throw out to you. In Stevens County, they are building, I think it's 6 units, they're townhouses, they're all connected, and they're planned to have at least four family childcare programs in each of those. So it's, I don't know the specifics about how that works out with the county. And if they aren't able to fill them all with childcare providers, as is the main goal, they are also meant to be affordable housing units as well. So the county has a backup plan, and I think the other 2 units, that's the plan to use them for that specifically.
That's what Mills did too. So when they we remodeled that duplex in the sense that it could be a single family or a 2-family a double family dwelling. So if the childcare thing fell through or whatever, dissolved, the city isn't going to be stuck. They've got a usable building that turns into housing, which rural communities need more housing anyway.
Another thing, there's a county that, again, to the point about there's all sorts of businesses that are always interested in helping but don't know what to do. One county's tackling that by creating a fund at a foundation so that businesses can, this one's there's one in Becker County too, but the idea is that they, if you want to do fundraising, if you have I've got money that I want to put towards helping support childcare, but I don't know what to do. So they have an advisory board that, will direct that funding, and based on what the community says they need, or if they can have childcare providers directly apply for it. So that's another idea. And one other thing, I know that a lot of the providers that work with Head Start as a partnership, they're able to oftentimes have a second set of hands or a sub, and somehow or another, I just feel like that is kind of key to somehow figuring out
sustainability.
If you can, because I don't want to use this phrase, bless your heart, but you've been in it long enough for you to know, you figured out your methods, but it's really truly hard to attract new people into it, to sell them on this idea of, hey, you're going to be alone with kids for 10 hours a day.
I have 3 subs.
So yeah,
that are my family members, so I don't have to pay them, and I don't have to have workman's comp. Workman's comp is no joke, because you have to have workman's comp if you have subs. But if they're your family members, you do not, and they work for free. So, but anyway, I honestly believe, and I said this when I was on the panel, if I did not have those subs, I would not still be a childcare provider, because I would have no free time. Right now, I went on my grandson's 2nd grade field trip last week because I had a sub, and my husband's going on the Itasca field trip because he could take the time off, and I would not be doing this if I did not have subs. I would have quit a long time ago. Someplace where I could got PTO and gone and done all those family things, because that's, at the end of it, that's a pretty big deal.
Corporations being able to help, because things like when you don't have benefits, when you're self-employed, but being able to take time off is also about just being able to stay in the profession and to avoid burnout. And something that we're able to do with Head Start funding is, we try to supplement the income so providers get days off, but, and if providers can work that in, but then you have to charge, if you want to be paid for your time off, you got to charge your families to then pay their regular child care, but might have to pay a second person
Try real
childcare.
hard not to, I try real hard. I actually have an unpaid vacation worked into my childcare, so that families don't have to. So, yeah, I take the week of July 4th off every year, and it's unpaid time for me, so.
Can one of you talk about DigiKey? They provide okay, can you
No, they
what are
don't.
they doing?
Well, we're working together.
We are working on Thief River
I
right
read
now.
somewhere that are they doing research on it, or?
So we're doing a strategic supply plan there for children's finance with Advanced Thief River, DigiKey's involved, Sanford. We've come together and we just met today.
We did.
So we have 4 goals we're working on, like doing a social media push and trying to get more ideas out to the community on what childcare is. We're working on putting together a pod model situation. We're working on expanding the childcare center. We're working on training with providers and helping with that provider burnout. So the CDA in the schools, that's a big push because we just don't have the workforce to expand the childcare. So we need, and we're coming together as a community for that.
Being positive here with the study and the assessment we have on the area, I know Heartland Lakes Development Commission would be interested in trying to be the conduit to make something happen. But some way, got to get that information and design something that'll work. The contact is Mary Thompson.
Yep.
And we work with her. Like I said, we've talked about this probably as much as you have, and we just haven't been able to visualize a model that works. But we want to do something. You can get the grants. Building it's easy.
Yep. I think having that core team, like we saw the big success in Roseau and Bemidji. Roseau right now has a plus.
We don't have a negative anymore. We did a rural child care innovation program. Or 6 years ago.
Yeah, one of our first biggest successes.
I like the New York Mills model from the standpoint.
Yeah, very much so.
You're not hanging in the end with a building and trying to figure out what to do with it at all.
Warren just passed a half-cent sales tax to pay for child care.
You could do a couple, 2 or 3 of those in different parts of the community.
One thing
Yeah.
we've talked about is a lot of high schools too do, they have a construction class that they build a small house where the high school students, so, one thing Mill said, if this works, they've got other lots that they own, and they're like, maybe we just get one of those small houses from the high
I was
school.
gonna say, our high school's up for bid right now. for
Which
$8,500.
costs, kind of next to nothing in the housing market, and
That's our
it's like kind of a
high school house,
twofold, and I think too, it's looking at empty spaces that already exist. So, we've put childcare in churches, we've put childcare in nursing homes, we've put childcare in community centers, because the space even exists. Like you said, the space, as long as it's affordable, you can usually find the space. It's the sustainability and attracting people into the field that's.
There's tax forfeited land in certain parts that could be available if you have to dig into it, whether it would work or not, but there's ways to do it.
Yes, thank you, Dave, thank
Yeah.
you, because I think that needs to be a takeaway from this. That, who's gonna contact Mary Thompson?
I got to run, we email.
Okay, I really think then
Missy
that
emailed
is, we're talking about economic development, business partnerships, very, very creative models here, changes in licensing. Mary is a person that can really work with the business community. Thank you. I just think that's a wonderful outcome of this session.
I have
Bill, did you have one more thing?
Only one, I promise. So if I were a parent in this room tonight, have a couple kids where it's difficult to find childcare, I may have to quit my job because I can't do it, what's the one takeaway that I could, optimistically take away from you tonight?
Change careers to be a childcare provider. It's a good time to start childcare with the startup grants and the revitalization.
I said, if I were a parent. But what's one, as an attendee, what could they take away from this other than starting a new business, quitting their job and starting a new business? Where could we hold out hope for the
Get on that core team that we're gonna start.
Mary Thompson. Get Sarah's number, because she's gonna be the person who knows about the newest business that's started that might be looking for a spot, or, you know.
If you're a parent looking for work, but you need childcare to start working, and it's kind of this catch-22, you apply at Head Start to see if you're eligible, and we'll place you, and we'll also, the childcare is free. So for families, it's subsidized to the, so families can have a leg up too, so that is something.
And if you don't
Thank
qualify
you.
for Head Start.
And if you don't qualify, then what?
My
Yep.
hubby has
I
early
asked that
learning
pretty
scholarships, childcare assistance. If you're a parent of 3, it's highly likely that you might qualify for one or both of those. So those are both financial assistance programs for working families or not. And honestly, early learning scholarships, there isn't a working requirement.
But
So,
with the early learning scholarship, does the provider have to be parent aware rated?
yes,
Yes.
they do, or participate. But
Say that again?
to use early learning scholarships, the provider needs to be participating in the parent aware program.
And the child has to be 3. So it doesn't matter if you're
We're working on
infants and
changing that.
We're,
That may
yeah,
very
that's
well-
starting,
they're
that's starting to
sickly.
gravitate south, I mean,
Oh,
to
okay.
younger ages.
currently,
Essentially, contact
Currently, the
the hubby
child has
because
to be
one
3.
way or the
By
other.
September.
But there are, as a grandma now,
Yeah.
and there's many young children or young adults out there that have good incomes, are not Head Start.
don't
They don't qualify, but, the grandparents may not always be available, other family members may not be available. It's a real struggle. And then I hear that you all have these grants. They're all separate. It seems, I have done childcare in the past. It's a very difficult job, but also, you are not only making the meals and being there 10 hours a day, how do you have time to do 5 separate different grant areas and keep track of all of that? Run the food program, put that in, and then provide excellent, high-quality care for these children. Main thing is to keep health and safety. We know that, but it is a shock that we have as many providers that we do, because this is a hard job. And so I think streamlining some of these, it's great that you've got the grants, but who has the time to try to manipulate and go through and manage all of those? Even if you're retired, I don't think you have time for that.
I will add to that too, it's probably a little easier if you've been doing it for 20
I
years.
was
And
gonna
these
say,
things
yeah.
incrementally came along as you got
Yeah.
comfortable doing them. But when somebody new is thinking about entry, looks at all this stuff, it's overwhelming.
Some of them
That's
are
why
as
we
easy
have
as just an
wayfinders.
application. The regional grant is pretty competitive, so that's one I've done every year, and you have to write why you want it and what, it has to fit certain priority areas and those kinds of things. The stabilization, or the revitalization grant, that was super easy. I just applied for that. I got brand new flooring in my daycare house throughout, and I sent the only effort really was taking a lot of pictures of why I needed the new floor. And that one was very easy to fill out. They're not competitive. There's only one competitive grant. Otherwise, it's just a short application for almost all of them.
Yeah,
So
this is one
there
page.
are a lot of them, but they're not super difficult to fill out.
I know we do need to close
No.
this, but I do want you two, these two
We need Sarah to explain what she
ladies,
does.
work
She
with
would help with
childcare
that.
providers directly, and you would help with grants, wouldn't you? We would help them set up their business.
Yeah.
She will now.
I would be
I contracted actually with Head Start, and I had the family childcare in my home for 17 years. And now I go out and help the providers get rated if they want for parent aware and coach them along. So yes, if they wanted help filling out, any type of paperwork, we're more than willing to do that. And that's probably
That's
Sarah now.
more so my route now. So I'm Wayfinder. So basically I help if you're interested in startup, I can help you through that process, what resources are out there for like retaining, because it is a really hard job. So if you're feeling really stressed out, I try to say, hey, what can you look at, what can we do differently, what's available that they might not know about. I've done childcare, and before this position, I did not know about many of these resources. I was like, that's available? And you think you know, but you're so busy doing stuff during the day that if you don't have that team, you don't know what's available. And then expansion, of course, but we don't get a lot of expansion in this area. But even with the clients I have worked with, I've had no centers. Every single one of them have been family childcare in either Bemidji or Hubbard County. So, I mean, those were our two, like we did a strategic plan and looked at the areas that we needed the care for the numbers. And so our numbers are going up, but we need to continue to support, like we need to look at the people who are in business, like how do we keep them in business and doing this and that high quality. So when I start with somebody, I try to follow through for at least 2 years, about resources, and I get them hooked up with Parent Aware, just because it's really nice to have a team. So.
Like when we do a rate study with a new provider or someone that's been doing it for a long time.
I just did the business leadership class
Just last year, you know, so.
yeah.
So when we do the rate studies, we look at what you would be reimbursed at if you were a 3 or 4 star Parent Aware rated program. And I lived here in River Falls, we only had one out of all the, I think there was 60 providers, only one that even went through Parent Aware. Because, okay, we've always had waiting lists. So why should we do Parent Aware? We don't need it, we don't need to, you know, it's just too much work. But then when we start saying, hey, you'll get reimbursed more, you also get the Building Quality Grant, you also can access the early learning scholarships for your families. All of a sudden it's, oh wait, just put some money there, okay, maybe I will do it. So.
But one other question, if somebody like Heartland Lakes Development Commission did, say, build a duplex, could get some grant money from wherever, do some of these grants, would they qualify for some of these grants for gap funding?
Okay, I just can't thank you ladies enough for sharing all of your resources. They did bring handouts here if people are interested in grabbing a little information. I think we have a couple real major outcomes from this forum. Missy, you're gonna contact Mary, and I bet Mary is very interested. And maybe you can invite her to one of your collaborative meetings. And just, great. I think that's fantastic. Thank you, all of you.